Hi, I'm Joe Calderoni. I'm the Senior VP for Communications at Mount Sinai, South Nassau. Welcome everybody on Facebook. We've been doing a number of these COVID-19 updates for everyone. Today we're very lucky to be down in Long Beach in front of our Long Beach Emergency Department, the only freestanding 9/11 receiving emergency department on Long Island. I'm here today with Dr. Dawn Williamson. She is the co-director of the emergency department here at Long Beach, and I'm also very pleased to have with us Scott Cremens. Scott is the director of emergency services for the city of Long Beach, and he's also the fire commissioner for the city of Long Beach. Two very well-known figures in Long Beach who I'm told have sand between their toes. That's the expression, the phrase down here. So we wanted to come down to Long Beach and just give you a little update, especially for the people on the Barrier Island. But before I do that, just a general update. Today, on Monday, we have a census of 464 patients at the main hospital in Oceanside at Mount Sinai, South Nassau. We have 375 COVID positive or patients who are suspected to have COVID-19, and we have approximately 67 patients on ventilators. We are, without a question, still in a very unprecedented situation, uncharted waters. Our staff has been doing a terrific job, but they are stretched beyond what they've ever seen in their medical careers. There's been some talk in New York, and the governor's been talking about maybe the curve is starting to flatten. I don't think we've really seen that yet on Long Island. We're hopeful that maybe we're a week or so away from what's happening in the city of New York, but at the moment, we're still seeing a very significant number of patients coming in. So I just want to, before we talk about anything else, I want to urge people to continue to practice good social distancing as we are doing, 6 feet away. Wear a mask if you go outside. Wash your hands, wash your hands, wash your hands. So also, before we get going, I just wanted to thank everyone. Last night, the Long Beach City Fire Department, as well as a number of other departments, Freeport, Baldwin, Valley Stream, Point Lookout, Lido Beach came down, right? They all came up to the hospital. A tremendous show of support for our frontline nurses, doctors, maintenance, support staff. They were at the hospital about 6:30 last night with the fire trucks and everybody in their turnout coats. And they applauded as our employees went in the building for shift change or came off shift. It was a tremendous boost to the morale of our employees. And I just really wanted to thank the fire department and everybody else who turned out. Also, we've had a tremendous outpouring of support from the community, including from Long Beach. I want to be sure to thank everybody in Long Beach who's been helping us. Long Beach Social Restaurant has been providing meals to the staff here as courtesy through some donors who have been funding the effort. We also have had a number of other establishments and individuals from Long Beach step up and help us. It really is much more than just about the food. It really shows the frontline workers that the community is behind them, and it's really lifting the spirits of everyone throughout the hospital. So thank you all for that, and thank you folks on the Barrier Island. So Dr. Williamson, you've been co-director down here since we opened the freestanding emergency department in August of 2015. You're a long-time Long Beach resident. I just wanted to come down and talk to you about, we do have some different procedures here since COVID-19. Just talk to us about what happens when someone who's seeking emergency care comes on their own, not via ambulance, who comes on their own to this front door of the facility.
Okay, sure. So some things have changed recently to protect not only the patients but also the staff. And when you come up to the front door of our facility, you'll note that the door is actually locked. And that's for the safety, your safety, as well as the safety of the staff, so people don't just come in and expose everyone. Now, there's a bell where you just press the bell, but as well, let's say you didn't note the bell, security is monitoring very quick triage. They'll ask, why are you here? You might be here for a cut hand. Maybe you're here for something totally unrelated. Even if you're here for that, you will have a temperature taken outside, a temperature taken, a pulse taken, and an oxygen level taken by a little portable oxygen monitor. If we feel that you're here for something totally not COVID related, then of course you'll just be brought right into a room and treated appropriately. If you're here for something COVID related or what seems suspicious to be COVID related, you will be brought around. If you can see where it says decon area with those red signs, you will be brought around to our decontamination area on the other side of the building, which I was told we're going to get to see that area.
Yeah, at the end of this broadcast, we'll actually walk around with you so you can see where you need to go.
Right. So you'll be brought in that way, because that way you'll be seen by the doctor in the room without exposing the entire department, because there's a separate entrance to the outside. We do have 2 rooms in the department that have negative pressure, so that what that means is the air is vented outside and not into the department. So one of the rooms is that decontamination room I talked about. There's another room for sort of more serious patients, and patients can be brought there because there's a lot of medical equipment in that room that we may need to use, and it's also negative pressure vented outside, so as not to contaminate the staff in the department.
So the bottom line, just to reiterate, if you come here and you're having a medical emergency, and of course you're maybe a little nervous, you've got anxiety levels are a little high because you have a medical emergency, and that door is locked, do not be concerned, because that door is being monitored 24/7. And of course the purpose of this, and we're doing the same thing similar in Oceanside, is we don't want to contaminate the entire emergency department.
Correct.
So we have to take these extra precautions for the safety of everyone.
Yes, correct.
Right. And in Oceanside, just for our Barrier Island folks, if you do present, if you come up to the Oceanside Emergency Department, we have 2 triage tents outside the emergency department. We're doing the same thing, where we have a forward screening area. If you come in off the Nassau Parkway entrance, you're going to be asked these same series of questions, and you're going to be either told to go to the triage tent for additional screening, or perhaps right into the emergency department. Same procedure in Oceanside.
Same procedure,
as here.
slightly different, but same
Right.
procedure.
So, have you seen COVID suspected patients here?
Yes, we have. We've actually seen several suspected COVID patients and several positive patients here, most of whom are treated and released. They may get a screening exam, they may need an x-ray, they may need some blood work. Stable, they're sent home with appropriate treatment and follow-up plan. There are several patients who we've had to admit to the hospital, to the main hospital in Oceanside directly from here, and those patients were admitted because of low oxygen levels or pneumonia or a combination of medical problems, and those patients are taken up to the main campus in Oceanside.
Of course, we have an ambulance in order to do that.
Yes.
If you do need to go up to the
Yes.
Oceanside campus, we have an ambulance here to help you.
We would admit them here and send them directly as an admitted patient to Oceanside.
So you're not waiting again once you
waiting.
get up to Oceanside. It's
No.
a seamless.
Seamless transfer of care. We have seen, in fact, we've seen several patients here, and I don't know if I guess I can say this, but I was tested COVID positive myself.
Well, I was going to ask you that. You mentioned before we started that
Yes.
you yourself have recovered from COVID.
I have,
So
thank goodness.
please tell us about that.
Okay, so I tested several patients here, and whether it was from here or maybe even from the community, you never know exactly where this is coming from. You can be around someone who looks well and they may have it, but either way, I was working and I suddenly noted that I had a fever. So took my temperature, I had a fever, and I had a swab taken and found out that I wasn't in fact positive. I isolated myself, of course, at home for 7 days. And after that time, I had no further symptoms. I was very lucky, very lucky. I in fact only had 1 day of fever.
You need to take care of that. Take care of that for a minute.
Okay, I had 1 day of fever, chills, body aches. I, thank goodness, never developed the cough or that terrible shortness of breath that we've been seeing. Did have some chest discomfort, which resolved, and I got better and came back to work.
That's
So,
terrific.
which is the
That's
majority
terrific.
majority of the people.
Now, just
will
just
have
so that folks who are coming here to get treated, we do have protocol in order for you to return back to work. I think you have to be 3 days without a fever. Did I get that right?
3 days without a fever, resolving symptoms, and at least 7 days.
So you obviously met all those criteria.
I'm now day 20,
Right.
21, I'm fine.
You could be immune. We don't know if that's true yet, but they're actually calling for plasma, blood from people who have had COVID, so that possibly that can be used to treat COVID patients currently.
I'm glad you brought that up because I'm going to donate blood, yes, for the plasma. And you have to be 21 days since your positive test and 14 days since your symptoms have resolved. And yes, if you donate the blood and if you have nice strong antibodies, hopefully those antibodies can be used to save someone's life, and I'm hoping to do that.
And the Mount Sinai Health System, which of course has an excellent medical school and a terrific research arm, is really at the forefront of some of this work. And what a game changer that would be if it turns out that the plasma treatments could help cure someone. So, Commissioner Kemmons, I want to turn to you. Again, thanks for being with us down here in Long Beach. You've been one of the most dedicated public servants that we know on Long Island, not just here in Long Beach. We want to thank you for your service, first of all, and I mean that wholeheartedly. So just tell us a little bit about the first responders and how they're doing, how the fire department's doing, and how the city of Long Beach is doing.
I can't say enough about our first responders, our paramedics, our firefighters, both paid and volunteer, not only in Long Beach, but throughout Nassau County. These guys are on a battlefield right now. The call volumes have doubled and tripled. They've seen some of the sickest patients they've seen in their career, and they're all working through it. You know, they have a great support system, and we're trying to get them all the needed equipment they need to protect themselves. Like everybody else is having trouble getting it. Nassau County Emergency Management has been supplying us some, and we've been trying to purchase it. But obviously, our first responders are our first priority to make sure we protect them and they can go home after their day's work. Our call volume has gone up significantly here in Long Beach. We're handling about 20 EMS calls a day. We put on a second full-time paramedic ambulance, as well as your South Nassau ambulance, so backs us up 12 hours a day, and we're getting through the call volume, but it is putting a strain on our services.
And of course, I mean, the entire health system is under a tremendous strain. EMS across Long Island is under strain. In the city of Long Beach, you have both paid and volunteers right here.
That is correct. The last paid fire department on Long Island, and we have paid paramedics, paid firefighters, as well as our volunteer paramedics, EMTs, and firefighters. And everybody is pitching in as much as they can to get everybody. These are our neighbors, and we have to help them and get them through this.
So as a first responder, when you take somebody here to the Long Beach Emergency Department, how's it been going?
We do bring several of our patients here. There is a Nassau County protocol, as well as we'll call up the emergency room staff here, speak to Dr. Williamson or one of the other doctors, and tell them what we have, and they'll direct us properly, whether yes, bring that patient here, or no, bring that patient to Oceanside. And due to the relationship we have, it has worked out very well.
Excellent. Okay, anything else you want to add, or Dr. Williamson, anything else that we need to let the audience know about, other than wash your hands, wash your hands?
I was just going to say that, you know, every article you read, every news, you just wash your hands constantly. Purell or any other hand sanitizer, just keep washing your hands.
Can I just mention that we are not a testing center. A lot of patients do come and ask just to be tested without symptoms. They're not really sick, or they say, I may have been exposed, and they just want to test. And there's an 888 number. There's a phone number to call for that. It's at Jones Beach for the testing, the Department of Health. And we don't come here just to get a test. Please come here if you're in need of emergency care.
This is an emergency department. This is for emergencies, not for routine care. Call your primary physician. As you mentioned, Jones Beach is still open for testing, but over there you need an appointment as
Need an
well.
appointment, yes.
Right. I apologize if I left anybody else out on the thank you list. Lido Kosher Deli, and also I think the Atlantic Beach Fire Department was there last night as well, so I just wanted to mention them. If I left anybody out in terms of who we need to thank, we have a list that's going to be on our website of all the businesses and individuals who have helped us out during this crisis. Please patronize them. A lot of the businesses are having a tough time themselves because of the lockdown. They're helping us, so you help them, and that really goes a long way. So I do want to just take a walk around. We have a few minutes left. I just want to show the folks on the Barrier Island, if you come, and this is true at night as well, right? Day or night, you come to the front door and it's locked, and you have that initial assessment inside, and you're asked to walk around the building just so that you're not disoriented. I thought it might be helpful to just walk us around so that you see the entrance that you're going to be asked to go to, again, in order to keep everyone safe. And where we're going is the decontamination entrance, and that's usually used for first responders. If they go to a fire and there might be hazardous material inside and they need to be decontaminated, that's usually where we take the first responders. In this case, we're repurposing it for COVID patients and suspected COVID patients. So this might be a little bumpy, but we're gonna walk you around to the building, the side of the building, so that you can see where this entrance is. So you're coming down here, and you come up the stairs, and you rang the bell, and someone has answered and opened the door, and they're going to do an initial screening inside.
Well, the screening will be done right here, actually. I don't know if you can see where it says no testing for mild symptoms. Right there, the screening will be done by the triage nurse or doctor, and you'll be evaluated right there, literally outside, so as not to contaminate the department. If it's a non-COVID issue, you'll be brought in. Otherwise, you'll walk right this way. We put up a lot of signs where you can see the car area.
These decon area signs, this is what you're going to follow. You're going to be asked to follow these signs around the side of the building.
And of course, if they can't walk, they can either be put in a wheelchair, or if they're that serious, we would bring them in.
And someone can assist them.
Assist, of
Right,
course, of
right,
course.
right, right. So again, we're making the turn. You're seeing the decon area signs. We're walking down the street here. We're going to go a little faster. I apologize for the back of us. I'll walk backwards so that you can see us. It's a short little walk, but it is around the corner from the main entrance. So we don't want anyone to be confused if they need to come to the Long Beach ED for COVID-like symptoms.
And again, you would be instructed to come here. You would still go to the main entrance.
Go to the main entrance first, and then, if necessary, you're going to come around here. Yeah, don't come here first. Good point. All right, watch your step here. So now we're going to make the turn. We're going to come inside.
We have both stairs and an elevator.
Right? If you need an elevator, we have an elevator. If you're ambulatory, we're going to take you up the stairs. We're going to show you what this looks like. Here we go. This is the official decon entrance. Come on up, come on up. You're just going to come up here. And what's going to happen here? Somebody going to meet you? You're going to ring the bell again? What do you got to do?
Well, they'll be expecting you. It tells you to ring the bell on arrival, but they actually will be expecting you.
Okay.
Because they've already met you at the front door, so now they're expecting you to be here.
All right.
Hi, it's Dr. Williamson. Can you buzz us in?
Well, the intercom works. That's
The
good.
intercom does work,
There
and when
we
they
go.
buzzed us in, I don't know if you can see, this is our decon area. We have oxygen ready right at the door, and if you can see, it's the gurney, the stretcher is right there. You can see there's double showers because it is a decon room. We normally use it for decontamination. In this case, it's for COVID-like symptoms. And right there is the machine that stays there. It takes your oxygen, your blood pressure, your pulse, can do a cardiogram, everything right here in this room.
And this is a negative pressure.
Negative pressure room, and if you need to take an X-ray portable X-ray device will be wheeled into this room, and an X-ray can be formed right in this room.
Explain again what negative pressure is. What is that a good safety feature?
Negative pressure basically sucks the air out of the room and vents it externally, not entering or mixing with the air in the main department.
Right. So you're here now, you're being examined, you may or may not get an X-ray. You could be released right from here.
Right from here. Most patients are seen and released right from here and
Good.
never contaminating the department.
Good. But if you do need to be hospitalized, you go up to the main campus.
Yeah, what's great is if you need to be hospitalized, the ambulance will meet you right here and take you up this down this elevator and right over to the Oceanside campus. Again, you still don't have to enter the department.
Very good. Okay. Commissioner, anything else on your end?
No, just once again, I want to tell everybody to keep washing their hands, and I can't thank all our first responders and all our hospital staff. A thank you is not big enough.
We agree. We want to thank you both for your service and for everything you're doing for our patients. Okay, thank you very much to our Facebook audience, and we'll see you again soon.
Thank you.